This is a little bit of a grim topic, some of what kills people, right? And so a lot of people will make the assumption or make the claim that you shouldn't do a low carb, a ketogenic, or carnivore diet, an animal-based diet, because you are going to increase your likelihood of developing cardiovascular disease due to increased levels of saturated fat consumption. And that is based upon epidemiologic studies primarily looking at populations where meat is part of the diet, but certainly nowhere near close to what we're seeing with, say, for instance, a carnivore diet. It's a very different metabolic state. There's different physiology that's occurring, and so effectively we have not studied this stuff, despite claims to the opposite, where people will boldly say, well, you know, we think that your cholesterol is going to go up and therefore you're going to get heart disease. And to be fair, many people on low carb, ketogenics, and carnivore diets do see their cholesterol go up. Now, the question is that population the same as what we see in the general population? I think there is increasingly more and more evidence to suggest that that is not the case. In fact, recent studies have been published have shown that perhaps high cholesterol in those situations is not increasing the rate and risk of cardiovascular disease. And so that is something that needs to be further fleshed out. Some of the work Matt Budoff does is encouraged by guys like Dave Feldman and so on and so forth, have shown that in a very narrow population, the so-called lean mass hyperresponder population, where they have very strict criteria for triglyceride levels and HDL levels, and so on and so forth. But that research is being expanded into a broader area where those tight cutoffs are being relaxed a little bit. And so we'll see as time goes by. The real answer is we just don't know. And anybody that speculates one way or the other, it's either going to increase risk or perhaps even decrease risk. It's unknown. That's just the real answer here. And the other question, and this is something that, you know, as you guys know, probably many of you guys know, I talk to people almost on a daily basis who have put awful diseases into remission by doing things like a carnivore diet, right? And just about, pretty much without exception, every person I've ever asked this question about, I will say, if indeed your diet has increased your risk of heart disease by some percentage, would you be willing to change that given what has happened to you? And almost all of them say, no, I would never change it because I feel so much better. I was living literally in a hellish existence. And this diet has allowed me for the first time, maybe in many decades, to actually have some semblance of a normal, happy, healthy life in which they feel good with that when they're no longer suffering either mentally or physically. So that's an important consideration. But just as importantly, it's like, I mean, we're all going to die at some point, despite what, you know, crazy wackos like Brian Johnson will ever claim. Oh, we're the first generation to conquer death. Yeah. Don't hold your breath on that. But assuming the vast majority of, in fact, probably all of us will die at some point, it's like, what are you going to die of? You know, if you don't die of heart disease, then what will you die of? You know, will you die of something like cancer? You know, infectious disease. What used to kill us all was infectious disease and trauma for much of humanity. But again, heart disease is something that most of us will die of. I probably will die of heart disease at some point, hopefully later rather than earlier. I mean, I think that's a fair hope. But I mean, to think that you're not going to die because you don't get heart disease, or to think that you know, you're going to live forever because this and that, or as one vegan famously told me, that I asked him, what do you think vegans die? He goes, oh, I think they die probably skiing accidents, which is absolute nonsense. This is the level of, you know, just sort of magical thinking that some people have around this. And so instead of fixating on, you know, what you're going to die of, fixate on how you live it, right? How do you feel while you're alive, and make the most of that, right? So instead of this craziness, because I can tell you there are a lot of people suffering out there that probably needlessly, right? And if you fix the diet, and again, I'll be the first one to admit, it's not just about diet. Diet is a very important aspect. Get good sleep. Don't be sedentary. Don't be obese. You know, don't be weak. Don't be a smoker. Minimize or eliminate drinking. You know, these are the things that can help you to enjoy your life, how many years you get. And this whole thing, again, the bottom line is people that tell you carnivore diet is going to increase your risk for heart disease are just making things up, because there are no studies that have been done on this. And I mean, a lot of people do their own study, and they can obviously see that they've improved their health significantly. Again, if what people are suggesting were true, we would be seeing all kinds of people dropping dead prematurely from heart disease on carnivore diets. We now have enough people that have done that we would see that signal, and we're just not seeing it. Right? That's the reality. All right, let me know what you guys think. Take care. Eat beef. Be happy.